a theater where the orthopedic was working. So they were used. When he did amputation, he gave me a leg to give him a bag to throw there. So my first time when he gave me a leg, first day I had gone to the theater. We were in what? Because I was witnessing, you can't start, doing such things. I think they left me to learn and do what you will be doing if you are working with a consultant, and their consultants were being worshipped like what? Everything you will see, even the system charge, when it sees round or what, the things which are there. But for me, they gave me a leg when he finished amputating and I was dying to see something with it. Is it what Musumeni, what do they call it? Cutting here like, I said, what is he doing? What is he doing? And then when it was off, he gave me to give him a bag. I just ran from theater, dressed in theater, as you see those surgeons with a mask, with this. I ran down to the matron's office to report this man. How can he cut a leg and give it to me? He's so unkind. So I ran, and the hospital was very, very big. In fact, like Northern, still St. James's is still the biggest hospital. But I ran, and the office was enclosed in. I went, I had never gone back to her office. I knocked. When she came, the way I was knocking, Africans. She came to see me there, crying. In theater, things said, what has happened? I said, that doctor, whom they call a doctor, has cut somebody's leg and gave it to me. I don't know where I was taking it. My God. And when I was, she had to say, sit here, do what, talk to me, like what, Oh, I said, he's very unkind. How can he cut somebody's leg and give it to me? So he said, also me, when I was like that, I used to fall down, to fall. Pass, when I see such, I don't know where I found myself. But now what you do, when they are doing such things, you just look there. You don't look, but you can't finish your nursing before you go in each place. Everywhere you have to pass through, so that when you finish nursing, you would have gone in each place. So then when I was going back on the ward, not in theater, I found the surgeon coming to report me. That colored, because they were calling just colored people. She has to be discontinued or what? But this one didn't discontinue me. They did what? They left me. I went somewhere else. So she told me, whenever they are doing such things, don't look there. What we want is you to finish that theater. She worked in theater for so many, witnessed so many things, but I will change you, take somewhere else where they are not cutting, where you can't see much blood. So they changed me. But I worked to other places and I enjoyed working there. Enjoyed. Got so many patient friends inviting me to their home because I used to talk with them properly, do what. But I tell you, if you don't know, these English people, they can tell you, they can make you do work which is not yours. They want you to do dirty work or what. And me, because I knew I had even passed through nursing here, it helped me. I knew that's not my work. They used to say, go and give that a bedpan. Go and do that. I said, you are telling me? Go and do it. You are the one who is supposed to do it. I don't do your work. I finished that one long time ago. I'm not. You are the one. They would do it. If they call me colored nurse, I won't accept. I will continue to do what I'm doing. The sister will just call me properly. I will ask that one whom they sent, what did she say? Colored nurse. I said, no, I'm not a color. I would just say, call me black if you want, but I'm not colored. You think you call yourselves white, whereas you are not white. I will show them. What do you call this color? When they have sent the color, what do you call this color? White. I say you are not as white like this. You are white when you are dead, because you are drained of your blood or what. But you are not white, mind you. They will just leave me, go and tell sister that colored nurse has refused. When I will see a junior sister coming, because they are junior sisters, they are senior sisters on the ward. What is it? I say no. One time, to make funny, things were fun. Somebody removed the false teeth. I didn't know, because you have to clean the old people's mouths and what. She was there expecting me to remove the teeth. I had never seen these things. So I said, but you know, I just saw her doing like this, putting them in a small container. I said, what is that? You have removed your teeth. I will run to sister. I said, you know, I can't do this because the patient, it isn't me. Don't think I did this. The patient removed all her teeth. My God. And sister will come running. You know this one, don't you see they have lovely teeth? They don't know this. You should have told her or what. After my nursing course, I started straight away midwifery. I did not stop to work or do anything. I changed even the hospitals. I went to Halifax General Hospital. It's also in Yorkshire. I worked there for 6 months. The first part went well. I did very well. I passed, I can't say, well, with flying colors, I must say, midwifery. But that one, we don't do practice or delivering or doing what. Then I applied to live north of England. I went to South End on Sea. Now it's closed. I did midwifery, part 2. There you had to live out and you had to do bicycles, going to visit patients, because if the patient is not a big case or a complicated case, you deliver them at home and enjoy home delivery. So that's part 2 midwifery. I started there, I did 3 months, then continued, did the going to the visit fields. You go out, visit your people whom you delivered at home. You visit them, you do nurse, everything, showing them how to take care of the baby, all sorts of things. Also, I got favors. I got so many presents from the patients whom I used to take care, not knowing, but they enjoyed the way I was taking care of them. I remember one patient in particular, she delivered, bled a lot, but I really did a good, just taking care, helping her, doing what. She was impressed. So after, when she got well, was discharged, came back from her home, brought a present for me. I had kept it up to this time from 1967, from 1966 up to this time. She took to Metron, and Metron had to call me when I went, and to go in Metron's office there is you must have done something wrong. I think it's wrong things, what we expected. So I was shaking, I went there, knocked, shaking. Then Matron said, "Oh, come in, come in." Instead, she was joking, she started joking. She said, "I hear you have been, mistreating patients. A patient delivered the other day, but you mistreated her." Oh, I said, "No. That one, apparently, she delivered, she bled. I was with her all the time. I didn't do anything wrong." She said, No, don't worry. I was just joking. She has brought something for you."
Tell us from when you left Southampton Hospital, Southend-on-Sea.
Southend-on-Sea. I went to America, but I went with some friends of mine, Bazungu friends. They were posted in United Kingdom, United Nations. Then I stayed with them, but I couldn't work in America. I was redundant, going to the park, doing what, for 9 months. Then I decided to come back to Uganda. I passed through London, spent a few days clearing my things. Then I came back to Uganda. I arrived to Uganda. Then Uganda, I found my sister waiting for me, my elder sister, the nurse. By then she was working in Fort Portal. I went home, but I didn't go straight away to the village. I stayed in medical hospital.